everyone, it's me again. I'm Lena and I'm from the Healthcare Landscape Group. In this video, I'm going to be talking about my main video, which is about the 12 weeks plan. So why have we jumped back to this topic again, you may ask? Well, the reason for that is we will need to plan our program. Each individual member has to plan his or her program for the next 12 weeks or 3 months. So in this video, I'm going to talk about each individual week and what we're going to do, the activities that we're going to do, and the focus areas too. And yeah, let's get started with our video. So our 12 weeks plan will be focusing on the functional skills and our knowledge in human science. But human science is only a partial part. The main part is the functional skills. What are the functional skills? Well, functional skills are skills that will help me with my work in the future and also my personal life as well. For example, this can be communication skills, numeracy, which is the mathematical, having the ability to use different kinds of concepts, math concepts and skills, and apply it to your everyday life or everyday career. The literacy, which includes the 4 main skills of listening, reading, writing, and speaking. Critical thinking and problem solving are similar, but they're different in some ways. This will help us in the future when we face difficult problems and scenarios when we are older. Teamwork and collaboration. Teamwork or collaboration is crucial for me as a doctor, since I will be working in a team when I'm in a hospital working as a doctor. Adaptability is also important, since I will be interacting with various patients, and that patients come from different backgrounds, and I will have to adapt to each situation. I have to know how to solve that. Empathy. Empathy is the ability to relate and put yourself in others' shoes, so that you know what they are feeling, what they might be feeling, and how to take action upon that. So for the first week, I have planned that for the first week I will be talking about the introduction, and for the first week only, introduction and communication. So for these, the activities include basic communication skills. I will be making all of my group activities, including the first, the second DE, and the main work on the basic communication skills, including 4 main skills that I talked about previously, and introduction to medical terminology. For example, the human science, what does it include? Just generally, all the things that we have learned about medical terminology. Or for Kelly, she might have to make some research upon that and put it into her video. Some resources for this are textbooks that include the medical terminology or things that we have learned, and also, of course, the internet. Then the second week I will be focusing on communication, specifically about patient interactions. So this will be communicating with patients from various backgrounds, and also various needs as well. Next, also in the second week, I will need to make a video about handling various conversations and providing clear explanations, because in this second week, I will be focusing on the communication, which is the patient interactions. I will need to know how to interact with different kinds of patients. Patients that are those patients that are a bit hard to deal with, toxic, and other patients are easier to deal with. The resources are role-playing as a patient or doctor. So I will need one member also needs to interact with me. I will be the doctor, and they will be the patient. I will need to interact with them, and based on their personal needs and backgrounds. The third week will be on numeracy, which is the basic calculation. Basic calculations, I'll be summarizing up what I have learned from the past few months that Mrs. Pratt has sent out in her third DE. A review about the basic math skills, concepts, and calculations related to fractions, ratios, and proportions, which I have learned already. Now those are the activities, and the resources are worksheets and practice problems that Mrs. Pratt sent out, or I need to search on the internet on my own. The fourth week will be on numeracy also, but this is about medications and dosages. So for the medications and dosages, the activities that are going to be included in that is the calculation of the medication dosages, understanding the units of measurement for the dosages, and also interpreting the prescriptions that a usual doctor would give out to their patients if their patient has an illness and may need help with some drugs. The resources can be dosage calculation worksheets that can be searched on the internet, acquired from the internet, or made from my own resources. The fifth week will include the literacy, medical documentation. So as a doctor, I must need to know how to document different documents, and the activities are reading and understanding the medical charts or graphs that may be presented on the hospital charts and graphs if you have seen them, or on the graph, the pie chart, some things like that. The resources are sample medical documents and guidelines for documentation. The sixth week will include problem solving and critical thinking skills, which is about this case study. So as a doctor also, in a team, we need to work out, in a research team for the doctors, we need to work out immediately what has this patient endured, and what is the cause for his or her illness, what are the treatment plans, and that's basically the case studies. I need to know how to analyze patient case studies, identify the potential problems, as well as developing appropriate solutions and also ways to solve that. Now those are the activities, and the resources is situations involving ethical dilemmas and real life examples, and also group discussions as well. Next, for the seventh week, it will also be about problem solving and critical thinking skills, but this time I'm going to focus on the ethical dilemmas, like real life dilemmas that I might be facing, and putting what I have learned about problem solving and critical thinking into applying it into real life. So for the problem solving ethical dilemmas, the activities that I have included and planned for myself is exploring the ethical dilemmas in healthcare, applying the healthcare ethical principles to decision making. And the resources will include situations involving ethical dilemmas and group discussions. So for the previous week, the resources will be about case study examples and group discussions. Sorry about that, I got a little bit mixed up. For the eighth week, we'll be focusing on teamwork and collaboration. Like I said before, this is crucial because I will be working with a variety of teams, with a variety of different team members that will have different personalities, which I have to handle that. And learning how to work effectively in healthcare teams, knowing each member's personality and their characteristics, their strengths and weaknesses, and how to use that and benefit the team also. Communicating effectively with team members and resolving conflicts within the team. Those are the activities that I need to do. I need to learn how to do that and carry that out in my video. Then for the resources is some team projects and group activities which I might need to have, like I will need to have my whole group do this 8th week with me, like the team projects, and just do the team activities so that I can test my teamwork and collaboration skills. The 10th week will be about adaptability. Adaptability is how to adapt to various working and learning environments while making valuable connections with everyone else on the team. Those are the activities. The resources is scenarios to test my adaptability and empathy. Next, the 10th week is about empathy. Understand and relate to the patient's nonverbal communication and building trust. The resources or the things that I'm going to depend on is the internet and the textbooks, but I have to also have some empathy exercises with my team members or my family members so that I can handle with the conflict and also handle the conflict and know how to deal with different kinds of people, how to get information from them as effectively as possible. And for the 11th week, I will be talking about the applications of all of these skills in healthcare. The applications of all of these skills, the functional skills in healthcare, and a few about human science too. And lastly, for the 12th week, I'll be reviewing and assessing the things that I have learned. I'll be reviewing what I have learned, just a summary, and also review the materials and my knowledge, review all of the functional skills covered, and feedback and goal setting for future development. In that week, I will be required to ask everyone for improvement comments or feedback, and planning the next journey of my learning. That is my 12-week plan that I have set out for myself, and here is the document that I have printed out. I missed out sorry about that. I missed out the 9th week. That is an error that I did not see. So here is the chart that I have made. 12 weeks plan. I missed out the 9th week due to some problems, and I didn't see that coming. Didn't see that mistake, but that is my 12 weeks plan. I'll be sending that in the group later on the deadline. That is all of my works for my 12 weeks plan. I hope that you learned something from this video or just review some of the things you have learned. Thank you for listening to my main video, and I hope to see you in the next video or next meeting. Goodbye, see you later.